Hello, my name is Alicia Madrid, and welcome to Tobacco Sensation class. Congratulations on taking the first great step towards a healthier lifestyle. So, title page, Ending Tobacco Addiction's Health Promotions. Today's objectives will be components of nicotine addiction, methods of quitting, tobacco and health, stages of changes, benefits of tobacco cessation. So let's start with a few tobacco facts. Smoking causes 443,000 deaths, nearly 1 in every 5 deaths annually. This includes 46,000 heart attack deaths and 3,400 lung cancer deaths among non-smokers who are exposed to secondhand smoking. Smoking is a major contributor to many chronic diseases that are driving up the nation's health care costs. Each year, diseases caused by cigarette smoking results in $96 million in health care costs, much of which is paid by taxpayers through publicly funded health programs. So the quitter's triangle. Just as there are components to being addicted to tobacco products, there is also components to quitting. Behavior modifications. Take the time to change the normal practices that you do daily. Take a different route to work or start a new workout plan, or even use your spouse's car for a quick change of environment. The key is to change the behavior that is comfortable and regular to your tobacco using lifestyle. Nicotine replacement therapy is a way of getting nicotine into the bloodstream without smoking. There are nicotine gum, patches, inhalers, tablets, lozenges or sprays, and you can buy most of these from pharmacies and other retail outlets. They're also available by prescription. Stress management. We all face stress in our lives. In fact, a certain amount of stress is healthy. It keeps us vital and prevents us from falling into depression. It's important to control these things that we can while being willing to let go of those that we cannot, such as getting up earlier to allow yourself more time starting the day. Take lunch or breaks away from your working area. Avoid eating quickly or even just asking for help when you need it. So nicotine. An addiction is a process that changes the chemistry of the brain and body. Causes withdrawal symptoms when the addictive substance, in this case nicotine, is not kept high enough. As an addictive substance, nicotine has a job to do, to be sure that the level of nicotine in the body stays high enough to avoid withdrawal symptoms. And the more nicotine your body gets, the more it wants. This is mainly because it takes more and more nicotine to help the body from having withdrawal symptoms. Nicotine has an extremely short half-life. This is to say, once inside the body, it breaks down quickly. This affects how frequently people smoke. You take a big breath of cigarette smoke, the nicotine zips from lungs into the bloodstream and goes to the brain, where it locks into special receptor sites. But within 40 minutes, it's lost about half its strength and you feel the need for another smoke. So people light up about every 40 minutes or so, and conveniently there are 25 cigarettes in a pack. That's today divided up to 40 minutes periods. If someone who smokes goes to a gym to exercise, they like a cigarette after a workout. You might ask why they do something that seems so counterproductive. The reason is the exercising makes you metabolize nicotine faster. So the level of nicotine in the brain has dropped faster, and users become aware that they feel like a smoke. It's the same explanation for the traditional post-coital cigarette. Romance has nothing to do with it. So, moving on. So the reward center, it causes a pleasant, happy feeling. Adrenaline increases heart rate and blood pressure, rapid, shallow breaths. Over time, these damage heart and lungs while increasing the risk of heart attack, stroke, and chronic lung disease. It is a vicious cycle. Brain generates craving. Inhale new nicotine. Brain releases dopamine. As blood levels of nicotine fall in your body, increases the craving, and then back to 1. So compared to cigarettes, equal to about 3 cigarettes, 1 can of dip equals about 100 cigarettes, or about 5 packs of cigarettes. Equal to about 7 cigarettes. 2 can a week snuff dipper equals as much as 1.5 pack a day smoker. And here's some lovely pictures of what nicotine can do to your body. So, explain the impact of a smoke-free environment for all employees on wellness. So you all know we are in the military. So some of the negative things here are decreased mental acuity, increased need for water, decreased lung capacity, increased injuries, decreased wound healing, decreased stamina. All these are terrible things to have if you're in a wartime environment. You don't want to get deployed and have all these bad things with you. So, moving on to consequences of tobacco on the body. The skin, nicotine causes blood vessels to constrict, limiting blood flow and thus oxygen and nutrients such as vitamin A necessary in healthy skin. Brain, stroke risk increases greatly, sometimes called a brain attack. Drug, for the bone, cigarette smoking decreases bone mineral density and increases the risk of sustaining a fracture or tendon injury. Heart disease and heart attacks. Lymphatic system, impaired mucus production and immune response, as well as birth defects, low birth weight, and SIDS. Here's some more thing. A list of additives allowed in the manufacture of cigarettes consists of 599 possible ingredients. So cigarette smoking is a major cause of a lot of these things in the United States. So oral frerics, those are the cancer sides. Breast and lungs, kidney and uterus, stomach and pancreas, bladder, prostate, and cervix. And then on the other side, we have chronic diseases, stroke and Alzheimer's, gum and tooth decay and COPD, heart disease, aortic aneurysm, peripheral vascular disease, erectile dysfunction, low sperm count, and osteoporosis. Here are some more pictures. You can see that mouth and jaws have been removed. The next picture shows direct effects of tobacco usage can have on individuals' teeth. Despite some individuals requiring life-altering surgery, such as a tracheotomy pictured here, they continue to smoke. That's a surgical operation that causes an opening into the trachea with a tube inserted to provide passage for air. Some individuals requiring life-altering, so they still don't care. Moving on, some methods of quitting. So they call it cold turkey. This is one of the most popular and well-known ways smokers choose to quit. Quit smoking is what is known as cold turkey. The phrase cold turkey is universally understood to mean to quit smoking abruptly, often without a preparation or a gradual reduction in amount of smoking. Quitting cold smoking is probably the most popular, while not necessarily the most successful. Methods for quitting it may also be the most challenging due to severity of withdrawal symptoms. Tapering reduces the number of cigarettes smoked little by little over a period of time. Also, he or she may switch brands by gradually going from a brand that is high in nicotine to one that is lower and lower. One day you are not smoking anymore, and then post-opening delays the first cigarette of the day and establish amounts of time. So despite how you choose to quit, it is a good idea to come up with a personal ideas of activities that you can use to do instead of using tobacco products. First, you must set a quit date. This is very important. However, prior to setting the quit date, you must understand that various behaviors you need to change in order to quit. In addition to that, you have to take into consideration the use of nicotine replacement therapy and tobacco cessations medications. So on the next slide, we're going to discuss behavior change. Pre-contemplation stage. Knowing your reason for quitting will help you make it through tough situations when cravings and temptations to use spit tobacco are high. Contemplation, start your quitting process by making a list of all the special reasons in your life to be tobacco free. For example, you'll save money, make your friends and family happy, clean up your breath, set up a good example for your kids, and avoid serious health problems like oral cancer. Preparation. It is important to set a clearly defined quit date, no more than 2 weeks after you decide to quit. Even if you think you can quit now, well, at least a week so that you can get prepared. Prior to your quit date, visit your health and care provider for an oral exam and to inquire about nicotine replacement. Action. While some people are able to quit spit tobacco cold turkey, others find that cutting back in their spit tobacco use and change some aspects of their behavior and lifestyle makes it easier. So maintenance. Build a support team that includes your friends, family, and a healthcare provider. Let them know that you are quitting and tell them your quit date. Enlist their help in this process. Your support team can help by encouraging you if you slip, by giving you a pat on the back while you meet your goal each day, and by being patient with any irritability you may have from nicotine withdrawal during the first week, or you are tobacco free. Termination. Make this day different and special. Change your daily routine to break tobacco triggers. Chew non-tobacco stimulants like sugarless gum or sunflower seeds if you need them, and stay busy and active all day. Exercise and drinking lots of water will help take your mind off tobacco and will help curb your appetite. Fall back on new action and thought responses that you practiced earlier in 2 weeks to get you through the cravings. Remember that each urge to chew lasts only 3 to 5 minutes. You can get through the cravings with deep breathing, exercise, and keeping busy. So on a quit day, do not smoke, do not use tobacco, drink lots of water, avoid coffee and alcohol. Nicotine withdrawal symptoms. So some things you might be feeling: depression, feeling frustrated and irritability, trouble sleeping, difficulty concentrating, restless and or tireless headaches, and increase in appetite. So there are ways to deal with withdrawal. Don't rationalize, avoid people, places where you're tempted, stay active, and remind yourself why you've quit. So we have a lot of things here, benefits of quitting: improved health, live longer, regain control of your life, save lots of money, smell better and look better, and set a good example for children and peers. So short term, 20 minutes, blood pressure and pulse return to normal. 8 hours, oxygen levels in the blood return to normal. 24 hours, carbon monoxide is eliminated from the body. So your chances of a heart attack start to fall. Lungs start to clear, and mucus and other debris. So these you have to keep in consideration, that the times may vary between individuals. Longer ones, nicotine is no longer detectable in the body. After 72 hours, breathing becomes easier, energy levels. After 2 weeks, circulation improves throughout the body, making walking and exercise easier. 3 to 9 months, breathing problems such as cough, shortness of breath, and wheezing improve. And then long-term, chances of heart attack is cut in half. In 5 years, the risk of heart attack and stroke fall that of a non-smoker, and in 10 years, the risk of dying from lung cancer falls to about half that of a smoker. So prepare for your quit date, begin medication follow-up, refill several days ahead of time, develop new habits while using the medication as an aid. There we go. Congratulations on taking your life back. This was Health Promotions, and I hope you will take all this into consideration. I hope it was helpful for you, okay? These are our references. Alrighty, have a great day, everyone.